Okay, good morning students. Today we are going to study what is exact color blindness, and we are going to study how to diagnose a case of color blindness. That test is called as Ishihara test. But before going for Ishihara test, we will discuss little bit regarding photoreceptors which are present on the retina of the eye. All of you are aware that two types of receptors are present on the retina of the eye, and they are called as rods and cones. These rods are responsible for dim vision. Okay, they act when you are in the dim vision, while cones they act when you come in the bright vision. Okay, and cones are also responsible for differentiation of various colors. So, with regarding, there are three types of cones. The first cone is able to recognize red color. The another type of cone is able to recognize green color, and the third type of cone is able to recognize blue color. Okay. So, what is color blindness? The color blind person is not able to differentiate these basic three colors, that is basic green and red color, which you all can able to recognize. And this color blindness is inherited disorders. Means what? It is coming from parents to you or parents to offsprings. It is called as inherited disorder, genetic disorder. So this for diagnosis of this color blindness, usually the test which is performed is called as Ishihara test. So what is that test? These Ishihara tests, usually 12 different charts will be shown to the patient, and the person is asked to identify the number, and that you have to compare with normal eyes, that is yourself. Okay, so this is Ishihara chart is like this. So these are different numbers are given on this chart like this, like this. So just we will ask to identify different numbers to the person, and we will just compare it with ourselves. So we will start. We are having one subject, rather it is not subject, is a patient. We will ask him to identify different color, but before I am asking him, I am going to show it to you. First you see that number, and then we will ask him to differentiate that number. Okay. For example, first this number, isn't it? Now we will ask this person to identify this number. Yes, you tell.
It's 12.
It's 12. So it is 12 number. He has identified. We will see what happens further. So this is another number. We will ask him to identify. Okay, students. Now see what is this number.
I can't identify.
Okay, if person is not able to identify, we will just proceed to the next chart. Okay, he is not able to identify this number. Good. So this is another number. Now we will see this color, whether he is identified this color or not. Okay, do you identify this? He is not able to identify this number. Doesn't matter. We will show the another number. This one. Okay. Yes, do you identify this? He is also not able to recognize this number. So such type of 12 charts are given to him, and he is asked to write the number on the chart, and finally you have to judge it. The examiner has to judge whether he has written normal number or not. Okay. So usually this such type of color blind person, they are able to differentiate bright color, but they are not able to differentiate light color. For example, this lady, which this girl has wear which color? Tell me.
Red color.
Red color. This is a bright red. He is able to identify that color. Now we will show. We will show that chart. On that chart, heart. Just point out heart. Which color heart is having?
Brown color.
Brown. He is saying brown. Okay. That intestine. Show intestine.
Also brown.
Intestine is also brown in color. Again, this show this color. Which color dress he has got? So this bright red he is able to identify, but he is not able to identify properly that light red color. Okay, faint red color you can say. The another girl, which dress she has wear?
Whitish.
Whitish. She is saying whitish color, right? So it is clear that this person is color blind to red and green color. So that is a diagnosis, and it can be corrected by using specific lenses. It is a genetic disorder. So this is the best example of study of color blindness. Okay.